Our project is The Rhythm of Your Heart, a Romance.
Our purpose is to identify whether arrhythmias are regular or irregular. Our materials are EKG strips, caliper, or calculator. The last two are optional. Our procedure is number 1, check regularity. And how we do that is count the boxes between RR intervals. Our safety precautions are if the patient shows signs of arrhythmia, that is a ventricular fibrillation, ventricular tachycardia, or a systole or complete heart block, please alert the provider immediately.
How to determine heart rhythm? Heart rhythm can be determined by a caliper or by counting big boxes between R waves. First, count the number of big boxes between two R waves. Then, count another set of RR interval and compare the amount together. If they are similar with the rest, then the EKG tracing is regular. If the amount is not consistent, for example, 3 boxes, then 6 boxes, then 4 boxes, then the EKG tracing is irregular. Regular or irregular. This EKG strip shows sinus tachycardia, and it shows a regular rhythm because between each of the RR intervals, there's about 2 to 2.5 boxes each. The next one is premature junctional complex, and it is irregular because between the first R and the second R, there is about 5 boxes, and between the third one and fourth boxes, there's only 3.5. The next one shows supraventricular tachycardia or narrow complex tachycardia. This shows regular because between each R interval, there is 1 to 1.5 boxes. And the last one shows atrial fibrillation. It is irregular because for most of them, there's 2 boxes, 2 to 2.5 boxes, but for 3 of these, there are only 1.5 boxes.
Real-life application. Electrocardiogram technicians must be able to apply their knowledge on how to determine heart rhythm in any setting in the hospital and in an emergency. Determining heart rhythm can give away the type of arrhythmia the patient has. The faster the diagnosis can help save a patient's life, as they are our number 1 priority. Although not all regular heart rhythms are harmful, there are many that pose a threat to human life. Understanding how to read an EKG tracing and determining the heart rhythm is crucial as an electrocardiogram technician. Investigation questions. Number 1. What is the difference between heart rate and heart rhythm? Heart rate measures beats per minute, and heart rhythm is the pattern the heart beats in. Number 2. How is the heart rhythm measured? Heart rhythm can be measured with a caliper or counting the amount of big boxes between R waves and comparing them with other RR intervals. Number 3. What are the methods used to measure heart rate? The methods to measure heart rate are 6-second, sequence, and 1500 method. Number 4. What type of arrhythmias are deadly? Ventricular arrhythmias are deadlier than sinus arrhythmias. Number 5. What is a normal heart rate for an adult? 60 to 100 beats per minute is the normal heart rate range for adults.
The end. Thanks for watching.